Hey guys, it's Jen. Hope you're all doing well. It is July 12, 13, 14. And I'm going to sit here and try to vlog as much as possible and then get these videos up for you guys. Sorry again, I've been MIA, but a lot has been going on. So right now I'm actually in July and I just completed my 6-month nurse anniversary. I think they'll call it that. So I've been working as a nurse for 6 months and boy, do you learn a lot. So I'm just giving you guys an update of what's been going on. So if you read my last Instagram post, remember that last video that I talked about Jaco coming to survey our hospital, and I was telling you guys how much anxiety that was bringing me, especially because I'm a new nurse and that I was hoping I wasn't going to be one of the ones that was chosen? Yeah, I was one of the lucky 3 RNs on the unit. Mind you, we have a 30 bed ICU unit, and boy, the nurse to the left of me was asked to sit and speak with the surveyors, and I was like, yes, they're not going to choose a patient so close to maybe her patient. And yeah, I was in the middle of setting up a TEE procedure, and my nurse manager came in and said, we're going to swap. Let me know what I need to do in here so you can go talk to Jaco, who wants to talk to you about your other patient. And that was about a minute warning. And I was like, I thought there was no chance. But I gave her a mini report, and then I took a breath and walked to the crowd, the group. It was, I think, maybe 10 people. And there was this one guy, really well dressed, was sitting there waiting for me, and it was on. So I'll probably do a little video, like really quick video on how to get through Jaco interviewing, but man, it happened to me. Anyways, I survived that. What else? So as a new nurse, about this time, it just depends on the unit, the patients, and how many nurses we have. So I've actually been tripled, and that just means that you take care of 3 patients versus 2 in the ICU. And sometimes it's a great manageable triple assignment, where maybe you have like 2 floor patients and then 1 ICU patient. It just really depends. This past Monday I worked, and I just had a really tough day just keeping up, and I never really felt like I was caught up, and I had a bunch of nurses helping me, and it was a lot. So physically, emotionally, mentally, I could not wait until I clocked out on Monday. Go back Tuesday, I have 2 of my 3 patients from the day before, and it was still just as busy. And what I realized is one of my patients, they needed more nursing attention, more emotional support, more things explained. So I was being requested a lot frequently, whatever. I was being requested to be in that room more than I probably would talking, and that takes up time. So I am still, taking each day as it is, as it comes, and I really try to just leave whatever happened that day at the hospital, working in the ICU. And I have a couple of friends that are working in the ICU and are about to get started working in the ICU, and it's a unit where you really can't bring baggage home. It's a unit where you have to kind of forget the last day you worked and start with a whole fresh new attitude towards it, because a lot can happen in the ICU, and some days are easy coasting and some days you're just like crawling out the hospital. And then there are days where your feet hurt, and then there are days where you're so busy that you haven't even thought about your own kind of like health, and like, have you eaten? Have you drank water? Have you gone to the restroom? Like, can you even feel your feet? So anyways, I'm still loving my job. I will say I'm surprised because, you work so hard to become a nurse, and you get a nursing job, and you get the unit you want to be in, but then I wake up and I'm like, oh, I gotta go to work. And I don't know if it's just because any job, that's how you feel. And that's just to get out of bed. Once I'm in the unit, I'm, obviously going. So at least it's not like I feel that way the entire day. I also believe, because I am a new nurse, the anxiety of when you go to work and you don't know what patient and what condition status they will be in. So it's almost like a jack in the box type of thing, and you're like, okay, so who do I have today? And is it someone who's really stable, getting better? Are we trying to transfer out the unit? Is it someone that just got admitted within the last few hours? How stable are they? Is it a patient that's, moving towards end of life? Is it palliative care? So it's just a lot of new things could pop up. And I think now, 6 months in, I'm feeling more comfortable with just, going to work and receiving my assignment. And the way I tell myself is receive your assignment, ask questions to the night nurse, and make sure it's a patient that you can take care of. Even patients that I remember I had a shift where, like in the beginning when you're a new nurse, they try to do their best to match you with a level of acuity patients that they believe you can take care of, and they kind of slowly work you up to maybe taking care of really sick ICU patients, maybe traumas, etc. So I've had some experiences with, I remember the day I was given, to me, what a real ICU patient was, and it was 2 of them at the same time. And I took report and I had a good day, and at that point I sat there and I did it. This is a patient assignment that was slightly more sick, and I was able to care for them. So it was kind of, I don't want to say a confidence booster, because not so much confidence, but I was happy that I was able to manage. And then there was another week where I received a report from someone that's coming from the ER, and they were in shock. So that entire assignment was a little above my skills, and I'm so thankful that working in the ICU, it's such a team-oriented unit. I had my charge nurse there, I had my manager there, we had the director of nursing there, and a couple of other nurses on the unit just helping me out. And so that situation was more like a couple hour-long code type of situation. And the one thing that I can tell anyone is, as a new nurse, every experience, take it in and learn from that. So because I knew I probably couldn't do things quickly enough, I had other people do it, and I'm observing. You observe everything. What are they calling for? What do they need? How are they hooking that up? What are they looking at? And if I were to be put in that same situation or similar situation, I feel like I would have, at least a kind of a step forward as to how I was going to react and what I could do. So yeah, take each day, learn, and keep on moving, and just keep depositing any of those experiences in your knowledge bank. And it just ultimately will continue to with baby steps, make you into a better, more experienced nurse. So that's that. So I am still in school. I still am taking classes at UTA, the RN to BSN online program. I believe I'm in the health promotions course this semester or session, since it's 5 weeks long. And again, assignments are due Wednesday and Saturday, and I have found it to be manageable, but sadly I'm not as passionate as I was when I was taking classes in my associate's program, which makes sense because I think it's just the online portion of it that you just have a ton of reading and assignments to do. There's no interaction, there's no learning. There's just, the face-to-face is missing. And I think that is definitely influencing my overall experience with the online course. But I am excited. I think I am technically halfway, after I finish this course, halfway done with the nursing courses. And I probably have 4 or 5 more nursing courses, I can't talk, and a literature and math course to complete. Then I'll have my BSN. So I'm glad that's moving along. So what else is coming up? I still have to do my ACLS and some other certifications and modules. So when you're working, stuff will always pop up and things that you can work on, which I'm excited about. I am still considering some certifications for ICU critical care nursing, and I was told, finish your bachelor's first and then get maybe a year or two of ICU experience and then go for those certifications, because you'll be better prepared for them, and I believe you would get more out of studying for the certifications at that point. All right, and that's pretty much nursing related. Personal work life, it's nice because now I feel like I'm making friends, and my friends is, hey, you're working today, are you my buddy? How's it going? And then we'll give each other a little life updates, and that's about it. There's no one that I'm going to get my nails done with or having lunch with. Actually, there was a couple when we had kind of lectures at the hospital, in services and stuff like that. We would go to eat lunch, but at least I'm getting familiar with people and they're getting to know me and I'm getting to know them. So that's always nice, because being the new person kind of stinks. And lastly, you guys know I'm expecting, and we just found out it's if you haven't watched, I have a personal channel. Go ahead and check out, I'll put the either link here or in the description box so you can find out the gender. And if you follow me on Instagram, you already know what it is. I'm super excited, but boy, the experience of working as a nurse, as an ICU nurse, and being pregnant, it brings its challenges along as well. But I will be updating on the other personal vlog channel that I have, just kind of giving you more thoughts and experiences of how I am handling this pregnancy. And so far everything's good, so I will keep you guys posted on that one. I'll leave the link below. Blah, blah, blah. I will leave the link below so you guys can check that out if you want. I don't want to bombard this channel with personal pregnancy stuff, so I totally respect you guys who are here just for nursing related information, and I understand that. So thank you guys so much. You guys have been such a great support. I still read your emails. I am still trying to reply to emails. Some of them are kind of a month or two old. I'm so sorry. I do respond a lot quicker on Instagram should you have any questions. And I just want to say I am getting a lot of responses regarding preparing to find a job and how to prepare your resume and stuff like that. I did those videos not too long ago, and you guys are replying back saying you did the same stuff, you prepared how I told you guys, and you guys are landing your first jobs, your dream jobs, and I am so excited for you guys. And I really enjoy reading, I don't want to say success stories, but it's nice to hear that the information I'm sharing, you guys are taking it in, really doing it, and then it's really benefiting you. You know, you're landing your first job, you are presenting yourself as a professional, even though you're a new nurse with no experience. But I'm super beyond happy for you guys, and I can't wait for you guys to start working and just really enjoy this new part of nursing on your nursing journey. So I guess that's about it. This video went longer than I wanted to, but don't forget to comment, like, and subscribe, and share the videos. Bye.